Hey everyone, welcome back to the channel. If you are studying for the CPC exam or dividing into medical coding, you are in the right place. This is Nilesh Shende and today we are covering chapter 16 of the ICD 10 CM 2025, that is certain conditions originating in the perinatal period. The code range for the chapter is P002 to P96. So let's break it down in clear and simple way. Let's start. First things, what is the perinatal period? Okay, so according to ICD 10 CM guidelines, the perinatal period begins before birth and continues through the first 28 days of life. Okay, 28 days of life, not weeks, not month, just the first 28 days. This is the perinatal period. Now we will see content means all points, all chapter specific coding guidelines of the chapter. Okay, so the codes P00 through P96 captures a varieties of conditions from birth trauma to perinatal infections and neonatal respiratory disorders. Okay, so now we will start this chapter. So these all are the contents. Okay, one by one we will see all points and we will see what is the chapter specific coding guidelines for this chapter 16. Okay, so let's start. First point, general perinatal rules. Let's start with the key rules about chapter 16 codes in ICD 10 CM. These codes are used to report conditions in the newborn. Okay, chapter 16 only, never the mother. Okay, so in chapter 15 we should not code. Okay, so remember chapter 16 newborn only and never used for the maternal record. Okay, so chapter 15 already I have uploaded. So if you want to watch that video, so I have given link in description box. Also the reverse is true. Chapter 15, which is for obstetric conditions, should never be used on the newborn's record. Okay, vice versa. Chapters 15 and chapter 16. One more thing, if the newborn has conditions from birth that continues into childhood or even adulthood, you can continue using the chapter 16 code for it as long as the condition is still present. Okay, so this is exception. So again I am repeating this point. Chapter 16 for only newborns and not used for mother record. Okay, and chapter 15 for mother, not used for newborns record. Okay, so vice versa. So for example, birth related brain injury, so for that also still coded under chapter 16 later in life if condition persists. Now we will see quick quiz. Can you use chapter 16 codes on the mother's record? Okay, it's simple questions. Drop your answers in the comment box. Now let's talk about the principal diagnosis for the newborn's birth record. Okay, so when a baby is born, the first code you assign is from Z38. Okay, this category is called newborn infants and it captures how and where the baby was delivered, like vaginal delivery at hospital or cesarean at home, like this. That Z38 will be categorized. This Z38 code is only assigned once at the time of birth. Okay, so we have to code once Z38 and only on the newborn records, not on the mother's record. Previously point we saw that. So main point is if the baby is transferred to another hospital, so can we code Z38 again? No, we should not code, we should not repeat the same code Z38. Okay, so If baby is transferred to another hospital, you don't assign another Z38 code at the new facility. Also, never use Z38 on the mother's record. It's strictly for the baby. Okay. Main points of this point: Z38 newborn, infant, place and method of birth. Okay, used once at time of birth, and if transferred, no new code. Okay, Z38 code. Okay, Z38 code only for newborn, not used on the mother's record. Okay, so for example, we will see a baby born by cesarean sections in the hospital would be coded as a Z38.01. But if that baby is transferred to the NICU at another hospital, the second facility should not code J38 again. Okay, so this is example. So we will see now pop quiz. Can the Z38 code be assigned more than once? Okay, it is simple. Already we saw this. So comment below with your answer. Okay, so you can write like a 2 and write your answers in comment box. Next, let's talk about how to combine chapter 16 codes with codes from the other chapter. Okay, this is important. Here is the rules. You can use codes from other chapter with chapter 16 codes if they give more specific details about the newborn condition. For example, if a newborn has a respiratory distress and another code from different chapter gives clearer descriptions, you can add the code. Also, if you don't yet have spinal diagnosis, you can use codes for sign and symptoms. But if the main reason for the encounter is a perinatal condition, that is something that happened during or shortly after birth, the chapter 16 code must be listed first. So always check if it's perinatal issue first, then build your code set from there. So we will repeat that. You can use codes from other chapter with chapter 16 only if they add more detail like symptoms or specific diagnosis. Use sign and symptoms code if no clear diagnosis yet. If it's perinatal condition, chapter 16 goes first. Okay. So for example, let's say a newborn has a jaundice due to prematurity. You had used the chapter 16 codes for neonatal jaundice, and you might also use a code from chapter 15 or 17 if it adds more information, but always put the perinatal code first. Okay, and drop your answers in the comment box for these questions. What come first, chapter 16 or symptoms code? Okay. Next point, fourth. Here is something many new coders miss. Chapter 16 codes are not just for babies. Okay, so be careful for this chapter specific coding guideline. If a condition starts during the perinatal period, that's from birth through the first 28 days of life, and the condition continues as the child grows, you should keep using the perinatal codes no matter how old the patient gets. So, yes, even if the patient age is 5, 10, or 25-year old, if the condition begins at birth and is still present, you still use the chapter 16 codes. Okay, so whatever age of the patients, we have to code chapter 16 codes only. Okay, so next we will see some key points. Condition starts at birth, keep using chapter 16 if the condition continues. Patient age doesn't matter, origin does. Okay, For example, if the patient was born with the cerebral palsy and that condition is still being treated at age 15, you had still use the chapter 16 code for cerebral palsy from the perinatal section. Okay, so let's drop your answers in comments for new true false question. Okay, you stop using chapter 16 codes after the newborn turn 1 month old. True or false? Okay. Next, now let's look at a very important guidelines. How to code newborn conditions when it's unclear whether it was caused by the birth process or acquired from the environment. Okay, so this is most important guideline. Here is the rules. If the provided documentation doesn't clearly say whether the condition was caused by the birth or from after birth, you go with the birth process by default. Okay, and that means you should assign code from the chapter 16. But if it's clearly documented as a community acquired, meaning it was picked up after birth from the environment or hospital setting, then you do not use chapter 16 code. You have to instead assign code from another appropriate chapter. We'll say key points. If documentation is nuclear, assume birth process, use chapter 16. If clearly community acquired, don't use chapter 16. And COVID 19 in newborn, see guidelines IC16H. Okay. So, for example, let's say a newborn develops pneumonia, but it's not documented whether it started during birth or after. You have to code it as due to the birth process using chapter 16, correct? But if the chapter or chart clearly says it was acquired after the week in the NICU, then it's community acquired and you have to use the code from another chapter. Okay, appropriate chapter. Again, one question, you can drop your answers in comment box. If it's not clear whether the newborn's conditions is birth related or not, what's the default assumptions? Okay, so write your answers in comment box. Next, here is a key rules in newborn coding. You must code all clinically significant conditions found during the routine newborn exam. But what counts as clinically significant? It is not just anything that's observed. The condition must meet at least one of these criteria. Some criteria is given. Okay, it requires clinical evaluation, it needs treatment, it lead at a diagnostic test or procedure, it caused a longer hospital stay, it requires more nursing care or monitoring, or it has a future healthcare implications. Okay, for example, something like a mild murmur that leads to an echo, that's coded. Or if the doctor notes feeding difficulty that needs monitoring, or an NG tube that's clinically significant. Note, these rules follows the general guidelines for additional diagnosis except for the last point, future health care needs. That part is specific to newborn coding and its testable detail in PCP or CPC exams. Okay, we will see keywords. Code if it meets any of the following. Okay, clinical evaluation, therapeutic treatment, diagnostic procedure, longer hospital stay, more nursing monitoring, future health care needs, newborns specific. If it affects the baby's care now or in future, it gets coded. Okay, so for example, a newborn with the mild jaundice that doesn't need treatment, maybe not coded, but if phototherapy is given even briefly, that's clinically significant and should be reportable. Okay, so share your comments in comment box. Like question is, what's the one condition you have seen in newborn that was clinically significant but didn't require treatment? Comment your answers. Next, chapter specific coding guideline of this chapter. Let's break down how and when to use the Z05 codes, which are for observation and evaluations of newborns for suspected conditions that turns out to be negative. You use Z05 code when a healthy newborn is evaluated for the suspected problem. But after exams and tests, it turns out the baby doesn't actually have the condition. However, you don't use Z05 if the baby has sign or symptoms. In that case, you code the symptoms or the actual condition instead. Z05 codes can be used in follow-up encounters like readmissions or doctor visits. After the Z38 birth code no longer applies, but remember Z05 is only for healthy babies. If you are using Z05 on the original birth record, it must be coded after the Z38 code. So Z38 comes first as the principal diagnosis and Z05 is listed secondary. We will see some key points. Z05 suspected conditions ruled out. Z05 suspected conditions ruled out. Okay, don't use Z05 if symptoms are present. Okay, can be used after discharge if baby is still healthy. On birth record, Z05 is secondary to Z38. Then use Z05 when suspected condition is ruled out, baby is otherwise healthy, use for the observation only. Don't use Z05 when baby has symptoms, code those instead. On birth record, Z38 principal diagnosis and Z05 is secondary. Okay, after birth encounter, Z05 can be principal code on readmissions if baby still healthy. Okay, so these all are the chapter specific coding guideline for observation and evaluation. So we will see one example. A healthy newborn is monitored for sepsis but tests are negative. Use Z05.1 for observations for suspected infectious conditions. Rule out. But if the baby had a fever or breathing problem, code the symptom instead of Z05. Let's start one small quiz. Okay. Question is, can Z05 is used if the newborn has mild jaundice? Let me know in the comments what you think. Okay. Next, chapter specific coding guideline. Let's wrap up chapter 16 guidelines by understanding how to code additional perinatal diagnosis for newborns. You should assign extra codes for any condition that requires treatment, needs more testing or monitoring, extends the baby's hospital stay, uses extra resources like IV fluids and special equipment or stuffs. Already we saw. Okay, also, and this is important, if the provider specifically notes that a condition has implications for future healthcare, even if it's not affecting the baby right now, you still code it. But there is the catch. This rule is only for newborns. You should not apply it to adult patient. So in short, if it's being treated or studied or flagged as a future concern, code it. Okay, assign conditional additional codes if condition needs treatment, requires investigation, cause longer stay, use extra resources, has future care implications. Don't apply this rule to adult patient. Okay, these all are the key points. So for example, we will see, for example, if provider notes heart murmur that doesn't need treatment now but wants follow up later, it still get coded because of its future impact. Okay, and one question, can a condition with no current symptoms still be coded in newborn if it's affect future care? Let me know what you think in the comments. Next, D, prematurity and fetal growth retardation. Let's start with how to code prematurity and fetal growth issue. Providers may use different definitions for prematurity, so don't assign a prematurity codes unless it's documented clearly. Okay, document should be there. Use P05 codes for slow fetal growth or malnutrition, and P07 codes for short gestation or low birth weight, but only based on actual birth weight and gestational age in the record. Okay, whatever in record, so according to that we need to code. If both are available, assign two codes from P07 with birth weight first, okay, then gestational age. Then we will see key points for this point or guideline. Code only if documented. Okay, use birth weight and gestational age. Two codes if both known, birth weight and gestational age. Okay, so these are the prematurity and fetal growth retardation related codes. Next, E, low birth weight and immaturity status. If child or even an adult, okay, had low birth weight or was premature at birth and it's now affecting their current health status, you still use code from P07. Okay, this is also linked to ICD 10 section IC21, which covers health status factor. It means a patient's past birth condition matters when it's relevant to today's health issue. Okay, so we will see key points. Use P07 if affecting current health, applies to children or adults, and reference section IC21 health status. Then next, F, bacterial sepsis of newborn. Let's go over sepsis in newborns. Use category P36 for bacterial sepsis. This includes congenital sepsis. If the chart just says sepsis and doesn't say if it's congenital or acquired after birth, default congenital and use P36 code. Okay, if the casual organism is already included in P36, don't assign a B95 or B96 code. But if the organism is not listed in the P36 code, add B95 to B96 code for the bacteria. Also, if the baby has severe sepsis or organ failure, you can use R65.2 and codes for the affected organ. Okay, so we will see key points. Use P36 congenital default. Add B95 to B96 only if organism not in P36. Use R65.2 for several sepsis and add codes for organ dysfunction. Then next, G, stillbirth. Okay, P95. Code P95 is used for stillbirths, but only in institutions that keep separate records for stillbirth. Don't assign any other codes with P95 and never use P95 on the mother's record. It's only for the stillbirth record. Okay, so we will see key points. Use only in this designated institution. No other codes with P96 or P95. Never used for mother's chart. Okay, so these all points we know. Next, H, COVID-19 in newborn. If newborn test positive for COVID-19, you assign U07.1 plus any codes for related conditions. If it's not clear how the baby got COVID, assume it's after birth, still use U07.1. Okay, but if the provider says it was contracted during pregnancy or delivery, use P35.8 for congenital viral disease plus U07.1. And don't forget, for all birth encounters, always start with the Z38 code for newborn infant. That's your principal diagnosis. Okay, so we will see some key points. Newborn test positive, U07.1. Congenital cases at P35.8. Start all birth records with Z38. Okay. One question for you. Okay, so drop your answers in comment box. If a provider document sepsis is newborn without saying whether it's congenital or acquired, which code do you want to assign? Okay, so drop your answers in comment box. Okay, and guys, this is the last chapter specific coding guideline point. Okay, so these all I try to explain with you. Okay, so if you want any changes in this video or in my explanation, so please comment and share your feedback. Okay, thank you very much guys. We will see next chapter in next week.